AHF started as more of a hospice service for people like end of life. Watu yani wamekuwa wagonjwa mpaka foundation yetu ilianzishwa ni kuwasaidia wakati wanaenda kufariki at least wapate good palliative care.
Hello, karibu tena katika show ya Tubonge Bila Kiki. Niliwaambia hapa is the only show in East and Central Africa. Yenye tunakupeleka kwa mto and force you kunywa maji. Because katika Tubonge Bila Kiki we don't want you to give up. Hapa ni kuelimishana, kufundishana na pia kujengana kiimani. Manake inaweza kuwa unapata elimu lakini imani yako unajengwa kivipi? Na leo tumebahatika sana, for the first time tumepata our sponsors wenye wametujoin katika Tubonge Bila Kiki, and then here to share wao ni kina nani, alafu wametoka wapi, so that next time mkiona logo hapo chini msishangae hawa ni kina nani. So atajiintroduce, aseme ni organization gani wame to join. So Dr Hamza, karibu sana katika show ya Tubonge.
Thank you very much.
Na shukran sana kwa one of us sasa.
Thank you very much. Yeah, so kwa majina umesema naitwa Dr Hamza Bulhan.
Okay.
I'm currently the regional medical manager for Coast Region for AHF Kenya. Najua vile umesema watu wengi watajiuliza what is AHF Kenya.
Exactly.
Right? Sounds just like any other organization, but now I'm going to explain about the uniqueness of our organization.
Wow.
So AHF stands for AIDS Healthcare Foundation, and this is a not-for-profit organization, which is an NGO, which was started in the US, in California in 1987. During that time, the AIDS pandemic was at its peak, and we didn't have medications to treat HIV. So you can imagine AHF started as more of a hospice service for people like end of life. Watu yani wamekuwa wagonjwa mpaka foundation yetu ilianzishwa ni kuwasaidia wakati wanaenda kufariki at least wapate good palliative care, pain medication and just control. But our motto remained as AHF being providing cutting edge medicine regardless of their ability to pay. And we have seen that we have advanced as a world. With the advent of ARVs and HIV medicine has grown, and AHF has grown from the US, and now it's in 46 countries, making it the largest NGO supporting HIV services in the world. So in Kenya, AHF Kenya now, us, we're 15 years old, and we're lucky to have you here and explain to you that AHF Kenya actually originated in County 001 in Mombasa County. Yes, that is in 2008. We had our 15th anniversary celebration last year in November. So AHF, the first facility we supported was in Tubonge, County 001, and basically what our activities are, you might be asking, the nini tuna support. It's basically, as you can see here, HIV testing services, HIV treatment with patient-centered care. By patient-centered care, tunamaanisha nini? We provide healthcare workers, human resource to the facilities, and the government facilities, level 2, level 3, level 4, all the way to level 5. So, and these are all cadres, all the way from HIV testing and counseling providers, all the way to our nurses, to our clinical officers, to our medical officers, to our health records information officers. And so all cadres we support, we employ, and we second them to the government hospitals to provide quality healthcare to the public. All in the aim of curbing this HIV pandemic.
But I'm trying to understand, where did you guys decide Kenya, and then especially Mombasa, the Mtongwe? Why Mtongwe?
Now, in the advent of the organization, of course, we know that after the virus was discovered in the US, our continent was hit very bad. Tulipigwa vibaya sana na HIV, and we're still one of the, we're a middle income country, but we still have a high burden of HIV and other infectious diseases, and of course the upcoming non-communicable diseases, which hopefully kwa Tubonge tutaendelea kuongea mbele. So in brief, that is AHF. So in Kenya we are currently in 10 counties, soon to be 12 counties, Mombasa being one of them, and as AHF Coast region where we are right now, in our headquarters. We support 4 counties: Mombasa, Kilifi, Kwale, and Taita Taveta.
Okay.
And in those 4 counties, we have 38 facilities we are supporting with staff, infrastructure, testing kits, condom distribution.
Okay.
So the list is long. Because
I'm trying to imagine when you said mmekuja mkasettle, does it mean that the statistic kwamba watu wako wameadhirika ni wengi, ama what is the target group sana ukiangalia?
The target group right now, the target group, of course, we are there in research and we work very close with our government agencies.
Okay.
Of course, we have the NSDCC, which we work very close with, especially when it comes to data, to know exactly where the hotspots are. And when we come in, we're coming in to complement and supplement the government and other implementing partners, because you've heard about other NGOs which are involved in HIV activities. So I like saying that we're a partner among partners, and we're always there to help where it is needed.
Okay.
Yeah.
So does it mean it's free of charge? Ama mtu akikuja lazima walipe kakitu?
Yeah, and that's the first thing which I started. If you look even at our banner, it says our mission is cutting edge medicine and advocacy regardless of the ability to pay. So all these services that I'm mentioning to you, when the patient comes into that facility, they don't have to pay a cent.
Because I'm sure kuna mtu hapo nje maybe ameathirika, and maybe he goes ama she goes to private hospital, and analipa. So don't you feel like mna interfere na government? Because government anasema mtu alipe, then you as an NGO you are giving it for free.
Yes.
How do you work with the government on that?
We work very closely with the government because as you know that in healthcare financing actually, domestic financing is very low.
Okay.
Financing mostly depends on out of pocket. When you nasema watu wanaenda kwa private hospitals, they pay for themselves. And of course now from the donors and from non-governmental organizations like the one which I work for.
Okay.
So we come in to fill that gap.
Okay.
All for the good of the average Kenyan.
Okay.
Yeah. So you can imagine the cost of procuring, let's say, ARVs, which are given free to patients. It would cost a patient almost 100,000 per year to get those medications. They're not cheap at all. And there are other supplementary medications that may be required because of the condition. And right now we have a high burden, of course, of diseases like diabetes, hypertension. So if you combine all that, the income that normal Kenyan is getting is actually going to be reduced, and because of those costs.
Okay.
The direct costs and the indirect costs.
Costs. Because I'm trying to imagine how is an infected person secured actually? Because you know, kuna mtu ana feel like I come to the hospital, I know someone's there, maybe ataenda kusema nje. Do you really have policy for you guys that muna sign with your staffs?
Yes.
For protection of the person who is infected?
Yeah. So that's a very, very nice question. That is privacy and confidentiality, which is a big priority.
Okay.
And since tuko kwa Tubonge, hata ukigeuka nyuma yako hapo, our core value number 1 is being patient-centered. Okay. With value for employees, respect for diversity, fighting for what is right, and being nimble.
Okay.
Like you've just exhibited an example of being nimble. Geuka in the middle, and we're supposed to be facing.
Okay, yeah.
So karibu sana AHF. So basically, as far as privacy and confidentiality is concerned, all our staff are expertly trained, and we have trainings and refresher trainings on confidentiality, just to guarantee the average Kenyan.
Okay.
You don't necessarily have to be infected to go to that hospital. You know, you can go seeking other services, for example, HIV testing. And we advocate for the general public that they need to be tested at least annually for the general population, and for those who are in key population, those who are in high risk situations. For example, female sex workers, or men who have sex with men, or people who inject drugs. They're at a higher risk of getting HIV. So then we advocate at least every 3 to 6 months they get tested. Okay. And that is offered free. And for our staff, once you enter the facility, we have our comprehensive care clinic, which is a special clinic dedicated to HIV testing, treatment. So when you go there, basically, ukiingia hapo, whatever mnaongea ni hapo hapo.
Okay.
So from us, the healthcare workers, I can assure you we have 100% confidentiality, and we've not had any issues with breach of confidentiality.
Okay.
So to the general public, nobody should be afraid to walk into a hospital to seek services, especially where HIV testing and management is concerned.
You know, someone is listening to us right now and Ashanga, welcome to our place, welcome to our health center, but we don't know where you are located. So where can they find you if they want to get such services?
So for AHF Kenya, like I've said, in Coast Region, we support 38 facilities. So probably your nearest health facility, your nearest health center, your nearest level 4 hospital. By level 4 hospital, I mean, like, for example, in Mombasa, if you go to Port Reitz, if you go to Likoni Sub-County Hospital, if you go to Coast General Teaching and Referral Hospital, you'll find us there. For what we're calling the level 3 hospitals or level 4, if you're around here in Kisauni, Nyali, Kisauni, Kongowea, Bamburi, all those are facilities I'm mentioning. Blaleo, those are facilities we support. If you're around in Changamwe, Jomvu, of course you can go to Port Reitz, you can go to Bikindani, you can go to Magongo, you can go to Jomvu Model Health Center. All those are government facilities, but we have our staff there. We have put our resources there to make sure that the patients, once they come there, they get high quality services. And it's the same in Kilifi County, it's the same in Kwale County, it's the same in Taita Taveta County. So basically we're all the way from, for anyone listening, we're all the way from the border in Lunga Lunga to the border in Taveta.
In Taveta.
Yes.
Wow, so mna reach watu wote.
Yeah.
It's such a privilege because sometimes you feel like if I go to a hospital, maybe the staff atajua siri yangu sana, so let me die nyumbani without going and seek assistance. So tumekuwa assured kwamba your secret is safe at the hospital. You just go, test, usiogope, and no one ataenda kutangaza nje aseme nini, because your health comes first, and tunambaga health is wealth, yeah? So as your organization, what's the major successful event ama something that imekuwa successful sana ever since maybe it started in Mombasa?
Ever since we started in Mombasa, of course, you've seen nationally our prevalence rates have been going down. That one we can say is a success on our part. We always advocate on calendar events to make sure that advocacy is a big part of AIDS Healthcare Foundation. For us to at least get the message out there, the correct message. Of course, as part of our core values, fighting for what is right, right for the patient all the time. So what I can say is I think we've made a difference to many lives. Currently, more than 100,000 patients.
Wow.
Yeah, who are actually serving in Kenya, who are positive and who are living positively with the help of AIDS Healthcare Foundation. And we're hoping to retain those patients, to walk with them through this journey, because it's a journey. Once someone walks into that health center, they get tested and they become positive. Already they've started a journey. And for us, the role is, it's not easy. It's not easy going and doing even the test. For any, even getting the test itself. So if you can imagine, once the test comes positive, what next?
You know, the time I wanted to test, I don't know what happened. Damu yangu ilisha. I think that's kafia.
Yes.
I think it's for everyone. Anaogopa like guy.
Damu karudi kwa moyo.
You know, ilikata kutoka. I think that's, people have that fear.
Yes, so it's an inherent fear because people fear the disease itself.
Yeah, exactly.
So you can imagine that person who has that courage, and that's what we're advocating for. Usiogope. Once you get there, overcome your fear. Know your status. Get tested. And once you get your results, whether they're positive or negative, life does not end there.
Yes.
HIV/AIDS is not a death sentence. The way I started by explaining how AHF originated, back then it was basically a death sentence, and our foundation was started basically to give someone a good end of life care, so that you don't die. You die in a dignified manner. But no, now we're in the age where it's a disease we can manage, and people of all cadres, all races, all religions, all ages are walking around and functioning very well in the society with HIV and AIDS. And we have many success stories. You know, when someone comes out and they say their own story, and hopefully we'll invite some of them and we can sit down and they tell you how the journey started and the steps that we've taken in making sure their health is better. And like you said, health is wealth. But what I would also like to remind people, health is not just physical health. You don't just look at someone, you see someone and anakamgonjwa. There's also mental health. And that's a big aspect of what we advocate for. So when that patient comes there and we serve the patient, we're serving the patient both physically and also mentally.
And maybe
psychologically.
Maybe a project that failed. Because I'm sure kuna successful event, successful project, then kuna some hazendagi penye.
Our project is basically continuous, but of course kuna challenges.
Okay.
Yeah, it's handle data challenges, right? Okay. And our challenges are mainly, we face challenges both from all the way from the national level. You know, you can have challenges from the international level. Let's say, for example, it may affect kila mtu. The war in Ukraine, or the economy, or the dollar, not or the strength of the Kenya shillings against the dollar, and basically the economic downturn that happened after COVID, that one affected all organizations, or the funding of the organizations. Okay. And we've had issues now at the national level where we have condom stockouts. Okay. We don't have enough condoms to distribute based on the demand that we have and the need that we know that the people we know need condoms the most, especially the special populations, and those who are at high risk. So maybe we've had issues with the government, especially with taxation of condoms. So I think we've been lobbying for tax exemptions for the same, so that condoms can be distributed to everyone who needs them. But other than that, we have not seen any, we cannot say we have a failure in any project, because we're always positive, we're always working towards making our patient lives better, and also contributing to the economy at the same time.
Okay, that's nice. Now let me just ask her, since you guys are NGO, maybe we have local organization around, wale wa mama, wa baba, the youth. Can they partner and they come here, talk to you, we need come to our project, our farm, so that you can give education to people?
So as part of our advocacy, so basically AHF, we have various programs with various age groups, where you said in the community.
In community.
So number one, we engage with CBOs, community-based organizations, through our AHF fund and AHF grant. So anyone who has any project which is beneficial to a certain community, they can come to us with a proposal, as long as they are registered community-based organization, and we go through the proposal, and once the proposal is ratified, they get the funds, and we follow up with them to see what impact they're making in the society. Two, we have our mentorship programs. We have a very robust mentorship programs. I think you've seen the banner of the Girls Act there. So in the Girls Act, we basically support young girls, both who are infected and affected by HIV, and also those who are HIV negative, from let's say families which are not very well off. So basically, this is a program which offers mentorship, supports them through school fees, giving them sanitary towels, what we call dignity packs. The basic things which if you don't have, it doesn't make you, it makes you feel less human. You know? And people who come from very poor economic backgrounds, for us, such programs, which is Boys to Men, we have Boys to Men and Girls Act that are in parallel, because you know we don't want to leave the boy child behind. So as far as the community is concerned, we're very active in the community. We like giving back to the community, but we also like the community to give us the ideas of what to do. So through our community-based organizations who we partner with, through our various mentorship programs, you will always find us on the ground.
On the ground, wow. Yani nasemaga, it's such a privilege when you get someone who is willing kukushika mkono. Like AHF amesema, if you are a community, you have a CBO, if unataka usaidizi, you can come talk to them as long as kuna proposal, so that you can assist the people who are really in need of something, either the pads, school fees, wajiza ndo muhimu sana katika maisha, the key one. So if you are a CBO and you need something, AHF wako open. Where can they find you? Wewe sasa. You.
Yes. So basically, they can come to our regional headquarters, which is at Epic Business Park, Links Road in Mombasa. Epic Business Park, 7th floor, the 3rd suite, exactly where we are right now. So once you get Epic Business Park, 7th floor, you can just come in, and we have an open door policy.
For policy, that's good. So you only karibuni, mlango ambayo imefunguliwa, so you're most welcome. So apart from AIDS, what else do you advocate?
So primarily anything that is affecting the society, we would want to to contribute, especially negatively and even positively, just to encourage. So one of the important things is, as far as calendar events are concerned, what we support is, as one of our core values is diversity. So the other day we had International Women's Day. Yes, and we were part of, those are some of the activities we support. Anything that embraces diversity, AHF is at the forefront of that. And also other calendar events, for example, upcoming now, which is, I think, something I would like to Tubonge na wewe, is about tuberculosis and World TB Day. Because the patients who are affected with HIV and AIDS, they also have other issues which affect them, just like any other person. They have psychosocial issues. They're also going through economic downtimes the same way we are going through economic downtimes. And for us as an organization is to ensure that the person's well-being is good, both physically, mentally, and also economic programs, which goes along with the Girls Act and the Boys to Men. Is a program called Food for Health. Food for Health. So Food for Health, basically, for those patients coming in, ambao tumesema maybe wako na uoga, they come into the clinic getting porridge free of charge, and during this hard economic times, we've seen that is something to give away. But being more forward thinking and sustainable, for the Food for Health program, the same groups that we're talking about on the ground, when they come up with a proposal specifically to do sustainable farming, AHF comes in and funds that. So as part of our Food for Health program. So those who have been affected in the particular hospitals, and they formed their groups, they can give us proposals, and we can give them support based on what we have been approved to give.
You know, we are talking there and I'm like, Miss Jessica Kombea Uji. So this education that I'm hearing today, it's something that I didn't know. And I'm sure pia kuna msikilizaji anashangaa hawa watu wametoka wapi. So it's something naliomega in our show, it's all about kufundishana, kuelimishana, kusaidiana. Because right now umejua, mtu amejua kuna boys to men, kuna girls, kuna watu wanaenda wanapata help. Na vile umesema in our calendar today, hii wiki, it's about TB. So as a doctor, hata ukiambiwa TB, what's TB? Tutasema ni juu tulifundishwa, lakini ukiambia TB someone ana differentiate tofauti.
Unajua kwa Kiswahili inaitwa kifua kikuu. Sasa sijui kifua kikuu ni ile umeenda gym ama
exactly. So wanagonza wanakuaga.
It's mostly about, because the main symptom associated with TB. So TB is an infection which basically can infect anywhere in the body except your nails, your teeth, and your hair. Any other tissue. You ulikuwa unajua?
No, hata wewe unashangaa.
Yes. So unajua, so you can see Waswahili wakiita waliita based on the main TB, kifua kikuu. So it is caused by a bacteria called Mycobacterium tuberculosis. It's a unique kind of bacteria. But sitaki kuingia into details. The way it is spread is basically through droplets. Remember how when we were talking about COVID and people were wearing masks? So droplets, these are aerosolized droplets. Droplets ambazo ziko kwa airway. So nikizungumza kwa nguvu kuna chance kidogo. If I cough, there's a higher chance. If I sneeze, there's even a higher chance of it going from one place to another. And most of the people who actually, the droplets enter and they get into the lungs, the immune system gets to control the TB. That's what we call latent TB. TB ambayo haiko active. So kuna difference kati ya TB infection and TB disease. So unaweza kuwa umeipata but mwili yako iko na nguvu ya kutosha, it fights back. But in those people who their immune systems are lower, based on one reason or another, there are many things which can make someone the immune system ikuwe chini. Yani kinga zao za mwili zipungue. So for example, kama uko na malnutrition, unaona hiyo ni utapiamlo. And then for those people who have diabetes, for example, they also present like that. Patients who have certain forms of cancers, patients who are undergoing chemotherapy, there are patients who are on some medications which reduce your immunity, and our patients who have HIV and AIDS, because HIV is a virus which actually attacks those immune cells. So immediately your immune system is down, it gives an opportunity to now this other infections ambazo zimejificha ficha ndo zipate nguvu, they take over. Ndio hizo tunaita magonjwa tegemezi.
Magonjwa
tegemezi. Yeah, opportunistic infections. So opportunistic infections, one of the major opportunistic infections in people who have HIV and AIDS is tuberculosis.
It's tuberculosis.
Yeah. And it's actually an AIDS defining illness. Ukipatikana na TB ni vizuri upimwe, because it's very, once you have HIV, you have a 5 to 6% chance of getting TB compared to someone who is HIV negative. But at the same time, the ones who are HIV negative, because there are many, they are more compared to those who are HIV positive, pia hao wengi wako na TB. So TB, it's not just for people who have HIV. That is a message I would like to pass across. There are very many people. For example, in Mombasa County, 80% of people who have TB right now are HIV negative. Only 20% are HIV positive.
Okay.
Yeah. So those are statistics from 2023 coming into 2024.
Okay.
Yeah. So basically the basics of, that's the basics of TB, that's how it's transmitted. The main symptoms of TB would be, would you like to know the symptoms?
Of course, yes. Tunajua only coughing. Peke yake kukof. So maybe I'll let you to fundisha.
Yeah, so for adults, we cough. Before we used to say cough of a duration of more than 2 weeks, but now any cough. And this cough can progress and become productive, whereas in some people they even produce bloody sputum. Then you have weight loss. And we're talking about significant weight loss. Ukiangalia one day you're wearing a size 40, the next day you're wearing a size 37, next day you're wearing a size 35, you know there's something wrong. Na chakula unakula vizuri. So there is that weight loss, and then we have night sweats. Night sweats basically ukilala usiku, and we know right now the weather. No, I don't want anyone
the global. The global kila mtu ana complain.
Kila mtu ana complain, so kila mtu hana TB.
Clarify.
So I clarify. It's drenching night sweats. Ni ile umelala ukiamka mahali umetoka hapo, you decide kushika your shit kuikunja hivi, itamwaga maji kabisa. Yeah. So that is drenching night sweats, na fevers. Joto kwa mwili. But in children it's very difficult, because mtoto wadogo under 5 hawatakuelezea exactly venye tunazungumza hapa. Hata kuja kwa daktari akakwambia I'm coughing. Or noticing the weight loss, but the symptoms are more or less the same. But now with children you'll have lethargy, and kama the child was active, unaona ameacha kucheza, they don't do what they usually do, and also their feeding becomes poor.
Okay.
So those are the signs that you look for in the adult population and pediatric population.
Okay. Maybe you can have such symptoms and you can go to the hospital.
Yeah.
And then kuna some people who are katika non-resource place. The challenge, how do you usually, as you as an organization, how do you usually work with such situations?
Yes. So basically in all levels of facilities, we have staff who are capable of at least assessing a patient, taking a proper history, ordering the necessary investigations, and coming up with a diagnosis. And one of the tools that we use in all facilities, which is standardized, is what we call an active case finding tool. So once a patient akiingia kwa any government facility, kuna zile maswali ataulizwa. Unakohoa, umepoteza kilo, umekuwa ukisweat sana usiku. I know now with the weather everyone will say they have been sweating, but ile kusweat zaidi ya kawaida. And of course kama umekuwa na fevers. So ukiulizwa hizo maswali, if anything is positive among those, then you will go to the next level where you will see a clinician, and they will now want to investigate you further. Of course, a proper doctor will take a proper history, and all our clinicians are actually proper. So we take a full history from the patient, try and understand if they have any symptoms, and then after that, now it's now the diagnosis. How do we diagnose this TB?
Okay, exactly. Because that was next to my question. Like, what the measures do you usually take to reduce?
Yeah. So regardless of where the patient is or the level of facility, basically the tests remain the same, and we have something called lab networking. So they don't have to have the machines in all the facilities. You just need a machine where samples can be collected and taken here. So as we started, we said TB can affect any tissue, any organ, except your nails, and teeth. So there's different types of, so TB can affect any, but the most common is pulmonary TB, which is the TB of the chest, the lungs. So for these patients, we usually take a sputum sample. Wanatoa kohozi ya asubuhi. Hiyo kohozi inapeleka. We have a machine called the Gene Expert. So Gene Expert is just the brand name of the machine. The technology it uses is basically it takes the DNA, it detects kwa hiyo kohozi yako DNA chembe ya hiyo bacteria, and then it replicates it and identifies that kama uko na TB ama hauna. Na pia inaangalia kama kuna resistance to one of the anti-TBs ambazo tunatumia, because you know with antibiotics now we're at an age where we're developing a lot of antimicrobial resistance. So our Gene Expert is a tool yenye tunatumia, ni machine tu, sione ni jina kubwa, ni kama machine tu, iko na cartridge hivi. So you process the sputum there, and we have it in many facilities, and those are part of the tests we try and advocate for from every level, from level 2 all the way paka huku juu. So that is one of the modalities ya kutest. The other one is a chest x-ray. So a chest x-ray can also look for those lesions ambazo ziko kwa chest. And for the Gene Expert, usio kohozi peke yake inachukua pia samples zingine. Kama ni kwa mtoto, unajua uwezi ambia mtoto mdogo atoe kohozi. Atoe kohozi vipi? So there you can either induce the sputum, kuna njia ambazo tunaweza kutumia kuinduce exactly, ama tunaweza kutumia other samples, even a stool sample size tunatumia so hiyo pia inaweza kupata hizo chembe. Na kuna wale wengine ambao unfortunately they have severe forms of TB. All TB hatusemi ni kuna TB nzuri, yote ni mbaya. But kuna zingine ambazo ziko very severe na treatment yake huwa inachukua muda mrefu zaidi. So kuna TB meningitis ambayo ina affect uti wa mgongo na the covering of the brain. So TB meningitis, na kuna TB ya mifupa na joints.
I think I've had ya mifupa.
Huwaiko. And that one the treatment goes long for like 12 months. Ya kutumia madawa.
Na usipotumia ukiacha siku moja?
So TB treatment ya TB is quite expensive. It is expensive because number one, if you develop a bacterial pneumonia right now, which is simple and not complicated, you will go to a hospital, you'll be assessed, you will get antibiotics for maximum 5 to 7 days. Maximum.
You know, because I'm sure kuna hiyo stigma hapa nje. People fear like if you have TB, I can't share your plate with you. Even I can't share spoon. So mtu anaogopa hata unamwacha alale kando. Do they feel your patient, kidogo nimwite client, the patient hata feel vibaya ama do usually advocate for such scenarios maybe?
For us, advocacy as far as TB and HIV, they go along not just in terms of the infection rates and prevalence, but pia stigma. Just stigma kwa Kiswahili tunaita unyanyapa.
Unyanyapa.
Sasa hiyo the stigma
unyanyapa.
So stigma is something we are battling on the ground very heavily. So umesema ukweli, kwa ground kuna people who don't want to share their plates, their glasses, because wanasema sitaki kupata TB, but that's very wrong. Wengine wanasema I cannot hug you, I cannot kiss someone, I cannot. So there are those myths, hizo tunaita misinformation, hizo tuziweke kando. So from the community level, TB, vile nimesema mbeleni, the only way you can get TB is when a person is infected and they're not using the correct protocols, hygiene protocols, like wearing a mask. If you know that you have TB and you expose yourself to someone just by coughing, because patients who have pulmonary TB, they cough a lot, and also sneezing. So those ones releases the droplets, and now that's when you have a chance to transmit.
Kwa hivyo turudishe mask back.
For those,
should we return back mask? Unajua sasa ujui jirani ni vipi, na tunafanya watatu, tunakaa na watu. So are you advocating hapo nje tafute mask?
It is so. You've seen in developed countries some places people actually wear masks full time.
Exactly.
But it's all about protecting yourself. And this is personal protective equipment.
Kama tembea na sanitizer kila ukishika.
So mpaka size even after COVID, the people work with sanitizers. The other day tulikuwa na macho hapa. You saw how it spread.
Yes, actually.
And now you started seeing the sanitizers coming back. So for me, is to sensitize the people that TB is there. And when we're talking about the global burden of TB, you know what is clear, I think what I draw from the WHO 2023 survey, we have data from 2021, 2020, and you can see that internationally, per year, on average, we have 10.3 million people infected with TB per year. You see, on average, like 2022, 10.3 million, going like that, 2021, 10.4. Okay. The rates were down in 2019. We were starting to control it. Because the strategy is to end TB. That is the end game. If we have not ended TB, we don't have success. Okay. So in 2019, we were on the right trajectory, but then COVID came.
Okay. Ikachafua kabisa.
Ikasambaratisha kila kitu.
Because and I'm now sure we had in your records, maybe most patients walikuwa na hiyo ugonjwa wengi
walipotelea katikati because now they became missed cases. So people are coming with cough, but instead of now focusing on TB, kila kitu ilikuwa ni COVID. So by the time the COVID pandemic was declared over, now we came back to start looking for those missing cases, and we are still looking for them up to now. Missed opportunities. That's why we have active case finding. So it is true there are people in the matatus everywhere, but we are tumekuja kubonga sio kushtuana. It's about kuelimishana. So for me, TB is not generally something to fear, but do not discriminate against anyone. Whether someone has HIV/AIDS, whether someone has tuberculosis, you don't discriminate. You protect yourself, but you offer them the necessary support. Na tulikuwa tumekwambia about how we can diagnose, and for our HIV positive patients, we actually have a new test which we use. It's a strip just like ile strip ya kupima mimba ile. So it's a rapid test. We call it urine TB lamp. And it's been helping us for those patients who have advanced HIV disease.
Okay. Yeah. Wow. Okay, maybe tukiongea next, do you feel there's innovation in TB research and treatment that looks so promising soon? You find medicine that pona kabisa?
Yes. So basically what we're working for, TB as a unique bacteria, and based on its replication, has made it such that the treatment takes a long duration. So for pulmonary TB and other forms of TB, except TB meningitis and osteoarticular TB, the treatment is 6 months. Where 2 months you use a combination of 4 drugs, and 4 months you use a combination of 2 drugs. And then for the TB of the spine, bones, and TB meningitis, you're taking medications for 12 months. So in terms of innovation, what we're doing right now, what we're embarking on is trying to reduce the time that you're taking the pills. Because what you want at the end of the day is the comfort of the patient. So you can imagine taking medications for such a long period. I started by telling you, you have a simple pneumonia, you get medications for 5 days, you're done.
That's only 12 months, 12 years.
So right now we're working towards shorter regimens. Hopefully by the end of this year, we'll have implemented that. At least the longest to be 4 months.
4 months.
The longest to be 4 months.
And that's cool.
Yeah, so that's innovation all the way from the World Health Organization, CDC, and hopefully we're going to get the supplies that we need to make that happen.
Oh, that's nice. Since on Sunday we've said 24th is the big day for creating awareness for TB. What do you feel is the most important significance on that day? What are your plans that you're planning to do?
Yes, we've seen in different places the day has, because 24th has landed on a Sunday.
On a Sunday.
Yes, and what intrigues me in my head is the significance of that day. For example, in our coastal counties, most of the counties will be celebrating it on Monday because it's a working day. But in Taita Taveta, we will be commemorating it on Sunday.
On Sunday, the same day?
On the same day. The significance of this day, World TB Day, is marked on March 24th because this is the day when the bacteria itself was discovered by a doctor called Robert Koch. You can guess which year that was.
I watch it repeat.
142 years ago.
Wow.
In 1882. So the battle to fight tuberculosis started 142 years ago. So for me, the significance is, even if it lands on a Saturday, on a Sunday, we will commemorate it, we will create awareness, because the aim is to end TB.
Yes. Tunaenda Taveta?
Ndani.
Ndani in the house. No, kuna mwingine anakusikiza najua aenda wapi.
Yeah, it will be an open stadium.
Okay.
Karibuni sana everyone who will be there. I think in Mombasa will be here. We'll be commemorating, and I think through various social media platforms. I think you can follow us on AHF Kenya, on Facebook and X, and as well as on TikTok. So all the information you'll get it there as far as where we'll be celebrating and commemorating World TB Day. Okay.
Maybe do you feel the awareness campaign was inasaidia sana for TB global?
Yes, yes, definitely. In preventive and promotive health, it begins and ends with awareness, because the message has to get out to the right people, the right message sent to the right people in the right way at the right time. Okay. Yeah. And that is why for us now we're even discussing about World TB Day. It's quite timely. We have discussed about HIV, but we know that we have a calendar event coming on. So Tubonge Bila Kiki tuko hapa to make sure that it's part of awareness. So anyone who is listening, I hope that they've at least gotten awareness on the background about TB, how it presents, how they can get help if they have any of those symptoms, and how they can get medication. And medication for this, for tuberculosis, is actually free.
Free?
Yes, it is free of charge. If we were not being supported by other implementing partners, ourselves and others, then the drugs are quite expensive. You can imagine taking antibiotics for 12 months, what the cost would be. So, and these drugs are actually free. So they're subsidized, they're given free to the patients who are found to have TB.
I think unafaa urudi na Kiswahili hapo. Maana kuna wengine pia wasikilizaji ni wa Kiswahili.
Najua nimezungumza kimongo sana.
That's so important part.
Yeah, so ukienda kwenye any health facility around coast ama nchini kote, na uko na hizi symptoms ambazo tumezungumzia, kama ni kukohoa, kama ni kupoteza kipimo chako cha mwili, ukiona size ya waist imepungua sana kwa muda mfupi, yani hiyo kusweat zaidi usiku, na hiyo pia kupata joto jingi kwa mwili, ukienda kwenye kituo cha afya utolewe sampuli hiyo ya kohozi ya kupima kama uko na TB ama hauna. Hiyo ambayo pia hailipiwi. Ni bure. Imefadhiliwa. Kwa hivyo kuna ufadhili kwa kupima na kutibu maradhi ya TB. So ukipatikana kwamba imekuwa positive, madawa yenyewe utapewa bila malipo. Yeah, so kwa tutasema nini? Kwa center zote ambazo tuna support sisi kama AHF, ukienda hapo we have qualified staff ambao ni hao madaktari, na wale pia wakupatiana madawa, na wale pia wakupima. Kwa hivyo ukienda kule it's a smooth journey. Tunasema seamless client experience. Yes.
Kaya unaenjoy customer service kwenye.
Yes. As far as customer service, as our customers are patients, and we advocate for the best for them.
So sasa you as a professional yako, what may you think ama action that can help ama progress to eliminate TB as in a public? Maana inakuwa threat sana.
Yeah. So one is awareness, like exactly what we're doing now, and through other forums, because we know the old form of transmitting information is going with time. If I ask anyone right now, hapo ngapi wamesoma gazeti ya leo, there'll be very few. I think it's those who are in the studios in the morning. They're doing content, so they have.
Nini unafikisha ujumbe? We need to know what is happening.
Yes. Yeah. So the newspapers have, they're reliable source of information. Yeah. But then we also have social media, which can be reliable, but there are no controls there. You see, so certain things like you're talking about, like obviously share hii na hii, hiyo ikiingia trend mahali ita trend. So it is our responsibility as professionals to make sure that the right information is going out to the right group. Yeah, or personnel.
Wow, that's very nice. Yani leo nimependa sana, tumekuwa class ya kufundishana, na tumeweza pia kukufunza kwamba mambo ya HIV tumegusia kidogo, and the important you should go and check yourself, ujue nini inaendelea katika body yako. Maana yake you have a full body checkup, because sometimes hali inaweza kuwa worse than things zikuwe mbaya. So tumeweza kuelezewa umuhimu wa kwenda kufanya check up, kujijua ili uweze kujua what next step itaendelea. So kama nimeambia leo tumekuwa na AHF kwamba wamekuwa sponsor yetu wa show. So kila muda mtakuwa mnaona wanakuja hapa ili kukufundisha different magonjwa, si lazima ukimwi peke yake. Kuna magonjwa mengi yenye yanaathiri yenye hawezi pata elimu, lakini katika Tubonge Bila Kiki tumepata hiyo chance ili tuweze kufundisha wewe. Na niliambia ujumbe maybe si wako, ni wa mtu mwingine. So tell a friend, subscribe so that ujumbe umfikie. Maybe Dr. Hamza, any last message kabla tumalize show?
So my message to everyone would be tuchunge afya yetu. Afya yako ni jukumu lako. Yeah, so we make sure that we take care of ourselves as far as kujijua hali yako. Hakikisha umeenda kwa kituo cha afya ambacho kiko karibu na wewe kabisa, and vile tumesema the process utapitishwa and we get tested, at least we know our statuses, and tuishi pamoja kwa uzuri. Do not discriminate each other regardless of someone's status. If someone you know ama umesikia mahali that they're HIV positive, we live in an age where we embrace that and we embrace togetherness. So those who have HIV and AIDS, those who have TB, wale ambao wako na magonjwa mengine ambao vile umesema tunaweza kuzungumzia, do not discriminate. I want us to all live together in harmony na kusaidiana, because that person who you're looking down on at that point when they're sick might come and help you at some other time. And these diseases do not know cadres, you know. There are doctors who walk around with this, who are sick. We have lawyers, we have all cadres, even our politicians. But everyone's health is their responsibility. But those who've been affected or infected, we hold their hands, tunashikana mkono, tunatembea pamoja. We're doing this journey together, and that's what AHF stands for, and that's what I am proud of while coming every day to work, knowing that I'm working for the betterment of the society.
Wow. Shukran sana, and from team Tubonge Bila Kiki tunawapenda. See you on our next episode. Asanteni sana.
Thank you.